cases of COVID in the UK has jumped by nearly 23,000 after it emerged test results had not been properly logged.
Well, it comes as Ireland and Paris face much stricter lockdown restrictions, while a government leak here has revealed there's a new three-tier traffic light lockdown system that's being planned. We can speak now to Professor Devi Sridhar, who's an expert in global public health, Professor Martin Landry from Oxford University, who's leading the world's largest study into the effectiveness of different COVID treatments, and also by Phil Clapp from the UK Cinema Association, after the news that the new Bond film has been delayed, forcing Cineworld to potentially now consider closing all of their cinemas, saying the industry is unviable. Well, Professor Sridhar, I'll start with you. This ridiculous, I mean, so many ridiculous stories today, but the ridiculous story about the cases, the positive cases, which have just been missed in the last week. After all the attention on test, trace, isolate, all the significance of how important it is, how do we miss 16,000 positive cases in 1 week,
and
which
why?
would have a material effect on lockdown decisions?
And why, Professor Sridhar, were they missed? Because I haven't seen an adequate explanation for this technical glitch.
Yeah, you're completely right. It's a bit of a mess because that means the figures for the past week or so have been off, and now they're trying to go back and rebuild those figures. But none of those 16,000 cases seem to have been traced, which is the entire point of the test, trace, isolate system. All I can guess at, looking at the age range and looking at what's happened in Scotland, is that this is probably university cases, and we might be seeing, the spikes being associated with universities returning because the age group most heavily affected is 15 to 24. And we had a similar thing happen in Scotland where about half the cases were coming from university clusters. But it's quite astonishing to me that you could lose 16,000 cases. And I think they haven't given really a good explanation beyond an algorithm or a technical glitch. That's all I can say.
Actually, Theresa Coffey, the government minister who's boycotting this show like they all are, day 160, she's been on the airwaves today. And she's saying that apparently it's a service failure, an IT failure, she says. It's her understanding. And she's then asked, have people been infected? She says they may well be, but they've been made aware. Well, she doesn't know whether they have or not, because the people that may have been affected by these 15, 16,000 cases weren't traced and isolated because the system didn't work. So Devi Sridhar, how can she know who's been affected? And the truth is, we don't know how many have been.
Yeah, this is a major problem right now because we're at a critical juncture of trying to bend the curve to end up like Germany, where we're not going to need harsher restrictions, unlike France and Spain. I mean, Paris is having a 2-week kind of circuit breaker shutdown of bars and some hospitality. And so to have it fail at this particular moment is quite difficult. And it just comes back to the point of using private companies, outsourcing. This is really a Serco test and trace service. It is not the NHS. And so just making clear to people that actually this is what happens when you outsource to private companies who don't have long experience instead of working through the NHS, which I think would have handled this much better.
Well, Phil Clapp from the UK Cinema Association, you must look at all of this technical glitch in despair as, you want cinemas to be able to operate. It is an industry which is on its knees. It's hard to go and enjoy your time at the cinema right now. There's practically nothing on. And then the big light on the horizon was the Bond film, wasn't it? And that's not coming out until next year. What do you think the future is? As Cineworld say that they're going to be suspending their chain?
Well, I think obviously, our thoughts are with the 5,000 staff members at Cineworld this morning who are facing such uncertainty. But it speaks to broader challenges the UK sector is facing. And, we have been able to deliver a safe experience. We have been able to deliver an enjoyable experience. 93% of people who've come back to cinemas have said that it was both enjoyable and safe. But we are at the moment, you've mentioned Bond, but there are other titles. We are at the moment lacking the big titles which encourage people out of the door. And, I think, cinemas have done their bit, as it were. We opened from July onwards. We've abided by all the government regulations. We're a little bit of normality in what's clearly very kind of strange times. And the frustration, I guess, is that we find ourselves in a situation now where companies as big and as important as Cineworld have to take these kind of decisions.
I mean, am I right in thinking of the 1.57 billion promised by the government to the arts sector, nothing went to cinema chains?
That, Factually, yes. I mean, nothing went to cinema chains. £30 million has gone to smaller independent venues, and that's very welcome. But the bulk of the employment and the bulk of the economy, which is driven by cinemas, is the larger chains. And they currently are benefiting or have benefited only from generic business support. And I think, we will increasingly be ramping up a message to government that actually, in terms of the value that cinemas provide, not just economically, but also in terms of kind of community value, that we need to see government putting some money into.
If we're still in this position in 6 months' time, 9 months' time, and Cineworld has shut and hasn't reopened, can a company like that actually survive?
Well, cinemas are a customer business, and the moment customers stop coming through the door, either because the government have locked down or because the cinemas decided to close, then that revenue stream stops. There is no other revenue. So it's undoubtedly a challenge. I mean, I think we all hope that by the time we get to the spring, the world will start to right itself, as it were. But I wouldn't pretend these aren't extremely challenging times, not just for Cineworld, but for the broader UK cinema sector.
Professor Martin Landray from Oxford University, one of the things which is keeping us going, of course, the potential for a vaccine. But the other thing is treatments are improving, aren't they? And we've seen, I think President Trump is on 8 different types of treatment, including one which most people can't get their hands on. If you go into hospital now, how good is the treatment regime for people suffering from COVID?
Well, of course, we've learned a lot about the virus and a lot about the disease. So there's an awful lot that we know now that we didn't know back at the beginning of the year. In terms of actual treatments of the disease, we have made some significant strides. So the first and perhaps the most significant breakthrough to date was the results around the steroid drug dexamethasone. It's inexpensive, about £5 for a course of treatment. It's available in every hospital and improves survival, reduces the need for a ventilator, and reduces hospital stay in the sickest patients. So that's great news, but that was a breakthrough back in June.
Now, you mentioned the sickest patients. We know that President Trump, was given dexamethasone. Does that suggest he was at one stage one of the sickest patients?
Well, I can't make any comment on what his health condition was or what the clinical decision-making was, because none of us are close enough. What I can tell you is what the evidence is, because that comes from the UK's recovery trial run across every hospital in the NHS. And that evidence is that for patients who've got COVID, who are in hospital, who need oxygen or need a mechanical ventilator, then the drug is very effective. For patients who are in hospital but do not have that sort of level of disease, they do not need oxygen or support for their lungs and their respiratory system, then dexamethasone does not work. So it's quite clear from the evidence. We got the evidence from the trial. We got the trial because here in the NHS, that was part of frontline care. Including patients in the trial was part of what we did. It's part of what we're doing as we look for further treatments.
One thing he hasn't been put on, interestingly, is hydroxychloroquine, which is the thing he's banged on about for 6 months. So it's interesting, isn't it? When it actually came to his own body and his own treatment, his own virus, no thanks. But he told everybody else to take it. Devi Sridhar,
could I pick up on
yes,
that?
Yes, you can,
One thing to say is that actually, it was that same UK trial, our same UK trial, that demonstrated that hydroxychloroquine, despite all the hype, hope and expectation, is not an effective treatment for patients in hospital with COVID.
Which is why the President of the United States, who banged on about it being an effective treatment and a miracle cure, isn't on it, which is all people need to know. Don't listen to the nonsense on Twitter from him. Listen to what he put in his own body. And it wasn't bleach either. Devi Sridhar, this issue with the testing is really important because of what we're seeing now in Ireland with the health experts recommending to the government full lockdown again. Similar in Paris, we now understand, where it looks like they may go into a 2-week circuit breaker full lockdown. Given that our case numbers have been so off now for the last week, are we heading inexorably to another full lockdown, do you think?
Unfortunately, I think we're heading towards more restrictions. I doubt we go back to where we were in March because we've learned more about the transmission of the virus. But I don't think we'd be asking people, for example, to stay at home and only leave your house once a day. I think we've learned outside is much safer. But are we heading towards a world where bars and pubs have to close again, like what's happening in Paris and has happened in Italy and states in the United States? Probably. I mean, you've seen that the way countries try to deal with this virus is different, and the way East Asian countries, and I keep talking about, East Asia because they are so much ahead of us. They are hit in January instead of March. They're dealing with this through a robust test, trace, isolate system, having border restrictions, as well as having clear messaging. Clear messaging, not like, how many people at weddings and how many people, here or there, but actually messaging of get outside, avoid crowded places, wear a face covering. This virus transmits through super spreading events, which are indoor, crowded, poorly ventilated places. It can move through the air. So even if you're 2 meters away, but you're inside in a crowded place, you might still get infected. We just need clear messaging.
Yeah. Okay.
Out.
Yeah, and the one thing we've never got in this is clear messaging.